Hello, my name is Eve, and today we'll be talking about Parkinson's disease. This is a progressive disease that affects your voluntary movements. In the brain, there's acetylcholine and there's dopamine. Acetylcholine allows for it signals your muscles to move. Dopamine, it signals the muscles to relax after each movement, because your muscles need to rest, all right? Well, there's an area in your brain that there are cells that produce dopamine, which allow for your muscles to be able to rest and go smoothly. Dopamine allows for precision with your movements, allow you to make precise movements. Conscious movements. If you want to do it, like say if I want to move my hand, as simple as it is to move a hand, it takes a lot for the body to allow you to move it smooth like that. It takes a real lot, y'all. Just simple movements. So in Parkinson's, dopamine is depleted because the cells that produce it have been destroyed. So there is no signal to relax your muscles after a movement. So what's going to be happening is that your muscles are constantly being triggered. They're constantly being told to move. So that's where you get the tremors from, because your muscles can't rest on their own. They're constantly being triggered. So you're trying to rest it, but it won't do it without the proper dopamine neurotransmitter. And that's why carbidopa is given, because it gives the brain the dopamine that it needs to allow for relaxation of your muscles. This disease affects the patient while they're at rest. So they'll have this pill rolling movement to their hands while at rest. Well, when they're trying to move, when they want to move, movements are improved, because there's so much acetylcholine at the site that it's ready for movement. However, it's not ready. There's nothing to relax it. So when they try to move, it's going to look like there's nothing wrong with them. But when they're at rest, that's when they get the jerks and tremors. They experience bradykinesia. This is a cardinal symptom defined as the overall slowness, reduction, or absence of spontaneous and voluntary movement. So patients with Parkinson's, they can get to a point where their moves are slow, but they have these freeze-ups, and this prevents them from being able to move at all. They don't know when these freeze-ups happen. So when they snap out of it, they're at risk for falling. So what you teach these patients when they're experiencing those freeze-ups is that they go the other direction that they was going prior to the freeze-up. So let's say they were walking. You want to tell them to step to the side after the freeze-up is over. Or just turn to the side instead of trying to go straight. Don't push through. Do not push through the freeze-ups, because you're trying that hard, and then when it's over, you can fall over. In Parkinson's, the gut is affected a lot. Understand that any kind of rest, that's when Parkinson's is triggered. So when you're resting, that's when your gut is digesting. You remember your rest and digest, so your parasympathetic nervous system. Well, that's being affected. It's not acting right. So this can cause constipation. It's not going to have a regular movement of their bowels. It's going to be stopping in stages. So you want to make sure we're checking for bowel sounds to make sure that their poo it's running. And we also want to check their last BM when they had the last bowel movement, because we don't want them to palpate their stomach to feel for masses. You can feel if there's some hard poo in there too. Okay. This is kind of like a mini version of ALS. In ALS, you're paralyzed and you can't talk or move at all. In Parkinson's, you have the ability to move some, okay? And in ALS, your electric pulses is burning your muscles. It's burning them from the inside out. And that's the same thing that's happening in Parkinson's. And what happens with burnt meat, it gets stiff and rough and hard. And that's what's happening in Parkinson's too. It's rigid, okay? Like trying to hold on to a bull with a stick attached to it. You know, it's like that. Okay, we talked about that. 1 second. They're going to have stiffness in the extremities, because understand, these are the muscles that Parkinson's affects, the muscles that's voluntary, that you can voluntarily move, okay? So your arms and legs are going to be stiff, all right? So now I talked about the slowing of the movement. It's going to be slowed. That is called bradykinesia. Akinesia is when there's no movement at all. I'm sorry, I wasn't trying to mix that up. So and you're going to experience both, okay? The slowed movement, you're not going to have proper regulation to accurately start your movement or to stop it on time. You're going to have a hard time starting to move, as well as a hard time stopping to move. It's not accurate. If I were to tell you to walk to me and to stop on a dime, you're going to fail it every time, because you don't have dopamine to give you accuracy of your movements. And when you have those freeze-ups, when you're not able to move whatsoever, that is called akinesia. Akinesia. And have a shuffling gait due to the stiffness, because your muscles are constantly firing. There ain't no rest in between. It look like you're being shocked, because you really are being shocked from inside out. You don't have your dopamine to relax that shocking nerve signals that's supposed to normally happen. They're going to have trouble swallowing, because Parkinson's, it starts on one side of the body and it travels to the other part. It's going to affect the whole body to where it's going to be hard for the whole body to move. Even the facial, your cranial nerves are affected. They're going to have a mask-like face, okay? Because the muscles they don't work right. It's not working right. They're going to have, it's going to be expressionless, an expressionless face. They can lose their ability to swallow and chew right. So they're going to have some mechanical soft, thickened fluids, mechanical soft diet, soft foods that don't require a lot of chewing, because that can further make it worse. Don't stress these patients out, because that makes it worse. You have to be patient with them. They can't do stuff fast like how you would want them, a human, to do, because their movements it's impaired. So you take your time. Do not rush these patients. Give them clothes that's going to better accommodate their condition. No shirts with buttons, no shoestrings. Get like a sweatshirt that they can easily slip on. Okay, stuff that without buttons, and that's not hard for them to put on. Their speech is going to be soft. They're not going to have their muscle. They're losing their ability to talk how they forcefully, because their muscles are being taken over by the nerves. They might lose their ability to smell. They're going to have some constipation, and they are at risk for depression because they're losing their ability to be able to take care of themselves on their own. So that can cause anybody some anxiety. So you got to be very sensitive with these patients. Their arms don't swing to the side when like normal when you're walking. Theirs is straight. Okay, because that's like a rest state when you're swinging your arm, and they can't rest voluntarily no more.